Hello, good evening. So today's topic is refractive error of eye. Now, what is a normal refraction? Now, normal refraction, if you see, normal refraction, if you see, here you can see the rays of light are focused on the retina. So here the patient will see very clear. Other one more refractive error is known as myopia. Here you will see the rays of light are focused in front of the retina. So the objects are seen very hazy, especially for distance. The patient will say that I cannot see distance very clearly. This is about the myopia. Astigmatism is also a refractive error where you will see the rays of light vertical and horizontal. One will be focused on the retina, other will be focused either in front or behind. So this is the astigmatism. And one more condition known as hypermetropia. Here you will see the rays of light are focused just behind the retina. Here also patient will say that I cannot see distance very clearly, especially even for near also. So these are the main refractive errors. Now, what are the causes of this refractive error? One of the most common causes is the axial length of the eyeball. The axial length of the eyeball, if it is very big, that is known as a myopia. If it is smaller than normal, that is hypermetropia. And about the astigmatism, horizontally it may be bigger and in vertical it may be normal, or vertical may be more and horizontal will be normal. So there, the glasses which are given is cylinders. So what are the main symptoms? Either maybe any refractive error. Here the patient will say that I cannot see distance very clearly, or I cannot see near very clearly. And sometimes there is a headache also after working for a longer time. Usually the headache is usually in the night because whole day the patient is working and using their eyes. And eye strain. Eye strain means there is a pain in the eye, or whenever they read or look at distance, there is a strain, like headache is there, or some stretching pain is there in the eyes. And if refractive error is not corrected in time, there will be squinting also. The squinting will be either convergent or it may be a divergent. Now, first I think we will talk about myopia. Myopia is very common, especially in children. Now, myopia in this condition, the child or adult will say that I cannot see distance. So, in this case, the cause may be, one is about the length of the eyeball, that is the axial myopia, or maybe curvature or index. What is curvature? Either corneal curvature or the lens curvature. Either it is, usually it is increased in myopia. Index myopia is a refractive index of the lens is increased. So basically the rays of light are focused in front of the retina. The cause may be axial, maybe curvature, or maybe index. So these are the causes. It may be congenital or it may be acquired. Congenital, it is since birth. So whenever the child is born, after about 1 or 2 years, when the child starts saying, when he starts saying the names of the animals or the alphabets, the vision correction or the checking of the vision is very important, and we'll come to know whether he has got any refractive error. One most common is simple myopia, where there are no degenerative changes in the retina. One more known as a pathological myopia, where usually the number is more than 6, -6, where you will see the myopia which is there is known as a pathological. Why pathological? Because in case of axial myopia, there is a stretching of the sclera and the retina, and there is a degenerative changes in the retina. That is known as a pathological. And sometimes even the macular lesion is also there, like macular hemorrhage is there. That is because of stretching of the blood vessels. Here you can see the fundus, retinal part and the choroidal vessels and the retinal vessels. Where you can see the white area, that is the sclera which is seen because of the stretching of the retina. Here also, whatever I said about the macular hemorrhage, where we can see the macular hemorrhage here, this is a macular hemorrhage. And we are going to talk about this acquired myopia. In acquired myopia, nowadays, most common cause is, especially in children, is known as a pseudomyopia. And this myopia occurs because the child always looks at near, never looks at distance. Why near? Because everybody knows last 2 decades because of mobile and because of the computer. And above that, of course, whenever they have to study, they have to read the books at near distance. And hardly the children, they look at distance. So all the time there is a spasm of the ciliary muscles, and because of that, the rays of light are focused in the front of the retina, and that is because of that the patient cannot see distance very clearly. So first, very important, we have to prevent refractive error by not looking all the time at near. That means the screen time have to be reduced. In between, the patient has to look at distance at least for about 10-15 minutes, and then they start doing near work. Every half an hour they're supposed to do. And eye exercise is a very important thing. And vitamin A, which you get from natural food, like papaya, mango, or carrots, you have to eat that. And eye exercise, very important. So this is regarding the children having myopia. And of course, whenever you go to eye surgeon, they will check with the vision and with the refractometer, they will find out what is the number in the glasses. So either glasses or contact lens or plastic surgery is the answer for all these things. And other things Dr. Gaurang will talk. So I feel this is very important, especially nowadays. At least about 50% of the children are having myopia, and that is because of all the time looking at near. And children, especially parents, they always give mobile, even at the age of 1 year or at the age of 6 months. Mobile is given to them, and they start playing games and everything at near. And especially in the night, also in contrast, there's in the room is dark and mobile there is a light, so there's a contrast. In that also they go on. So that is important. Take care.
All right, I hope you can see me and I hope you can hear me. Can you, Dr. Megha?
Yes.
Okay, so I think Dr. Pushpa has already shared about all the clinical details about myopia and especially all different types of refractive errors. The homeopathic approach is like always working with the idea of individualization. Individualization still remains the cornerstone of homeopathy. And in my experience, homeopathy medications have been useful for, especially in young boys and girls who are having increasing myopia. For example, we can gradually stop the progress of this increasing myopia. And I've had a very interesting case with very increasing myopia with many other ophthalmic issues in a young boy. And we analyzed his case in depth, and we found a very beautiful remedy for him based on his constitutional symptoms, his mind state, his physical state, his general state, his past history, family history. And that remedy helped him to kind of slow down the situation with the increasing myopia. In another case, in an old man, about maybe 50, 55-year-old man, with this sudden increasing myopia, with glaucoma, with detached retina, when we analyzed this case, I found the remedy physostigma. We found the remedy physostigma, and this remedy in 30 potency with a frequent repetition really helped to slow down the increasing myopia and have a more stabilized vision in his case. So a few good experiences with homeopathy. Along with homeopathy, lifestyle change, integrated change always helps. And as you know, in our clinic here in Mumbai, we have homeopathy along with integrated treatment. with nutrition changes, movement changes, sleep changes. And we have also a very senior ophthalmologist, Dr. Pushpa, who is associated with us. So together, we are treating many cases and we are trying to help as many patients, typically in all different diseases, but also because of our interest also in ophthalmology, we are trying to help our patients. So take benefits of homeopathy, spread the word around, and write to us. You have all our contact details. The email ID is gaurang@gmail.com. Thank you.